Much preparation takes place before you are taken to the surgical suite. To ensure a smooth transition, you may be asked to arrive up to 4 hours prior to your actual operating room time. You will meet with your surgeon and anesthesia team prior to being transported to the operating room. After your surgery, while you are in the recovery room, your family may be taken to your room to await your arrival. You will be moved to your room as soon as you are fully recovered. More information will be given to you in pre-admission testing about your day of surgery. The following slides will go over what you can expect while in the hospital. After having anesthesia, your post-operative diet will start with drinking clear liquids, which, if tolerated, your diet may be advanced to solid foods. Our meal service at your request room service is available to all patients. You may make your meal selections from the menu in your room. If you forget, a member of our food services team will contact you. Your caregiver may also order from the same menu for a small prepaid amount. Your recovery after surgery is very important to your healthcare team. We will frequently check your vital signs to determine how well you are recovering. This includes the possibility of interrupting your sleep. While this may disrupt your ability to rest, this is important to ensure your safety after surgery. Your breathing pattern is temporarily affected by anesthesia after surgery. Therefore, you will likely be using oxygen for a period to increase your air exchange. The respiratory therapist will check your oxygen levels after your surgery and determine when it's safe for you to discontinue using oxygen. They will also teach you how to use the incentive spirometry. This tool is used to help you take deep breaths. Taking deep breaths help prevent you from getting pneumonia. Anesthesia may cause temporary urinary dysfunction in the form of urinary retention or incontinence. Please communicate urinary issues with your primary care team. A sterile dressing will be covering your incision. This protective covering is in place to help prevent infection. Therefore, avoid the urge to peek. Your dressing will be changed as ordered by your surgeon. We will teach you how to care for your dressing and when and how to change it. An IV is placed prior to your surgery. You will receive fluids and medications through the IV. IV fluids are given after surgery to help keep you hydrated. You will also get an antibiotic through the IV before and after surgery. IV fluids will be discontinued when you are drinking adequate fluids, urinating independently, or as the doctor orders. The IV catheter remains in place until you are discharged. Deep vein thrombosis, also known as blood clot, can form in deep veins of your legs. A blood clot that breaks away and travels to your lungs is called a pulmonary embolus. Patients who have joint replacement surgery are at a higher risk of developing blood clots. The following are treatments aimed at preventing blood clots from forming: ankle pumps, sequential compression device, compression hose, and blood thinner medication. Ankle pumps are an exercise done by having your knee straight, point your foot down, and pull your foot up as far as possible. Perform these while in bed or while sitting with both feet to increase blood circulation. Sequential compression device, SCDs, are white inflatable sleeves placed on your lower legs that sequentially compress. These will be worn until you are out of bed and walking, and then periodically while in bed in the hospital. Based on physician preference, you may have compression TED hose or ACE wraps in place after surgery. You will be on a medication used to thin your blood as ordered by your surgeon. Signs and symptoms of a blood clot are sudden swelling in either leg unrelated to the surgery that will not improve with elevation of that limb, pain and or tenderness in the calf of either leg. If you experience any of these symptoms, notify a member of your healthcare team immediately. The number one way to prevent the spread of infection is proper hand washing. Everyone entering your room should be using the hand sanitizer located in your room. We encourage you to speak up when you do not see us sanitizing or washing our hands. IV antibiotics are given during and after surgery to prevent infection. Infections are rare following total joint replacement surgery. However, monitoring your incision site will help you determine if your surgeon may need to assess your incision. Signs and symptoms to look for are increased drainage beneath the dressing, redness surrounding the incision or dressing, opening or separation of the incision edges, increased pain at the incision site. If you notice these symptoms, notify a member of your health care team. Spiritual care is available to you during your hospital stay. If you desire a visit from the chaplain, your nurse can arrange that visit. The telephone in this picture is a hospital-issued telephone. This is how we communicate with patients, physicians, and each other. If we need to answer the telephone, we may need to briefly step away from you as to protect everyone's privacy. For the quickest response, call your nurse or nurse assistant directly. Their telephone numbers are on the whiteboard. If you cannot find your telephone, use the call bell as your second choice.